Now I have the pleasure to introduce Dr. MANAVI Sindal, who is the chief instructor of this course. I need a CV to come up if possible. Yeah. So she is the head of clinical retina and training at Arvind Eye Hospital, Pondicherry, and she is my mentor. She has taught me a lot about retinal training, retinal surgery. She was a university topper at MBBS level and as well as in post graduation. Her key areas of interest are VR surgery, ROP imaging, AI, teaching and training. She has 50 peer-reviewed publications, and I think there are many in the pipeline. 85 presentations and conferences. She is a reviewer for 18 journals. She has received the IGO Gold Award for the year 2021 and the Certificate of Merit for the year 2021. And she is an accomplished surgeon, competent clinician, and avid researcher. So she'll tell us about how to write an original article.
Thank you, Sunny. And our mentorship and mentee he's my mentor for publication, and so we are back and forth and friends from now. So I'm going to be talking about how to write an original article, and I take a little different approach. I will talk about how to actually go about the actual writing process. So we just had these talks from Sunny, who described how we design a good study with the sound methodology, good design of a trial. We collect our data methodically, and we have an appropriate statistical analysis done. Once we have done with this, we come to actually writing the original article, the components of which are the title with the running title and keywords. You have an abstract, and then you have the main article itself. You have the Equator reporting guidelines, for which case reports Dr. Chaitra just spoke about it. So a reporting guideline is a simple structured tool for health researcher to use while writing manuscripts. It provides a minimum list of information that it is required so that the manuscript is understood by a reader, can be replicated by another researcher, can be used by a doctor to make a clinical decision, and can be included in a systematic review. And there are various guidelines: the CONSORT for randomized trials, STROBE for observational studies, PRISMA for systematic reviews, RECORD for retrospective studies. These are available on the Equator Network's website and also on our IGO website, where there are links to these particular guidelines. So a manuscript would have these components: the introduction, material methods, results, discussion, and references. So an introduction should be succinct, it should be to the point, and should not be more than maybe 3 paragraphs. In the first paragraph, you would go about introducing your topic. In the second paragraph, you will provide the background for what you are going to address in your manuscript, and you would end your introduction finally with what is it that your study is about and present your hypothesis here. So if you look at this publication of ours about traumatic retinal detachment in a pediatric population, we have a first paragraph talking about ocular trauma, and then it leads on to retinal detachment secondary to ocular trauma in the pediatric population, and then talks what our paper is going to address. The material methods, this is where you describe what you have actually done in the study. When you describe the type of study, you have to have a statement about the Declaration of Helsinki, and you have to mention your ethics committee approval. This is required by all journals. In your material and methods, you will describe your data. You will describe how you sourced your data, who were the participants, or your medical records, how were they accessed, what were your inclusion and exclusion criteria, how was your sample size calculated, and what data have you collected. Sometimes when we go collecting data prospectively as well as retrospectively, we may collect a lot of data. This particular paper may not actually be talking about all of that data. So in that material method, just mention which data is relevant to the particular paper. If there are any procedures involved, like in a surgical procedure, describe the surgical steps. In an imaging paper, describe your imaging protocol. In a treatment paper, describe the treatment protocol, use the retreatment guidelines, etc. Define what were your primary and secondary outcome measures. So in this paper of ours on imaging, where we had compared the Remedio fundus on phone camera with the Topcon camera way back in 2019, which was published in 2019, we have described our participants, we have the sample size calculation, we have how the clinical assessment of the patients was done, how the photos were imaged, and how they were later on graded by the graders. Results. This is the main crux of your manuscript. This of course needs your data to be good and to be analyzed well, and you can incorporate the relevant flowcharts there to show how your patient population behaved. You also have the CONSORT and all these guidelines also have their flowcharts, which are mandatory when you are talking about randomized trials and all, and need to be included. So here when we looked at Avastin in babies, we have described how many babies were screened in that era, how many received Avastin, and in which group did their outcomes fall into. This is our ROT. So the results can be displayed or shown in your paper in the form of tables, in the form of figures. Roughly, journal guidelines limit these to about 5, but of course you should definitely be reading our author instructions properly to see which journal says what. In tables, typically table 1 is used to represent demographic data, and most of the times the last table would be some kind of regression or logistic analysis depending upon what the data is available. You utilize figures to show data. Some kinds of data are better shown as graphs or diagrams, and that can be done with this. Or you can also obviously have your clinical images, your fundus photos, your slit lamp photos, OCT images, B scans, depending on what your paper addresses. And then, of course, you have the descriptive part of the results. So when you have your results in your output from your statistician, you're going to sit down, you're going to look at it, and you're going to say, okay, this goes into the table, this is what I'm going to put in figures, and then this is what goes into descriptive. The descriptive data should not repeat that which is already there in the table or the figure, just highlight it, and whatever remaining data you have that is necessary to represent but doesn't go in these places, then gets enlisted in the descriptive data. So here are examples. So here is our tables. This is about from a paper on scleral fixated IOLs, and this is our table 1 which showed demographics and outcome measures and a lot of details. We had 2 cohorts in this. We had looked at the patients from sutured versus sutureless. We also looked at those with aphakia post-trauma and post-cataract, and both of these were presented in tables, giving the reader a full description of all the relevant information that is required. We can have a regression analysis table. This is on hyperreflective foci in DME, and you can see, and the ones which are significant have been highlighted by a double asterisk mark, showing us that gender, the presence of the lower level of triglycerides, presence of cystoid spaces, and subretinal fluid were what were found to be important in the regression analysis. Or graphs. Graphs can show some data better when you look at the complications in the eyes having pediatric traumatic RD, or you look at why did patients present to us why did diabetes present to a tertiary eye care center for an eye checkup. You can see which of the categories of diagnosis were most commonly in the presenting population. And we of course have our clinical images. We have shown OCT images to show what we mean by hyperreflective foci, and we have shown how the images were graded in our grading categories in our study. These results should be presented in a sequential order. Again, mainly starts with demographics, goes on to the data, which is the main component of the main study group data. Then you can have comparison of groups. You go on to talk about complications and then have your regression analysis. Finally, we come to the discussion part of the paper. Here, the first paragraph, it summarizes the main outcomes of your study. What are the points that you had in your outcome which you wish to highlight in your manuscript? And then you go on to discuss each point as you had presented them in your results with each subsequent descriptive paragraph, and cross-reference this with appropriate literature, which we just saw how to search for it. References, most journals allow around 40 to 50 references usually for an original article, but somewhere around 25 references suffice. These references should be relevant to what is your data in the manuscript. You can refer prior works who had outcomes similar to what you're seeing. Also refer prior works where the outcomes were contrary or differed from your findings. And of course, you need not quote all the articles in literature available. Finally, you come to the abstract. So most journals for original papers require a structured abstract. The guidelines differ on this from journal to journal, but on an average it's 250 words. Some of them have 350 words. And most of them have the description of purpose, methods, results, and conclusion. Here your purpose should clearly state your hypothesis or aim of the study. Your method should briefly highlight what you did. The results in the abstract should show what was your main finding or outcome that you wish to be highlighting in your paper. And the conclusion should be catchy, brief, and drive your point home. Keywords are the key to your article. This is what is going to help your article be searchable in PubMed. So choose appropriate keywords so that they show up in appropriate searches. How do you write on paper? This is the order I would write it in. I start with methods, which is what we have done and I know the best. Then I go on to results, the main crux of the manuscript on which everything rests. And then to discussion, I may write the introduction, maybe a bit with methods, maybe a bit with discussion, but usually later on. Then finally, after my main manuscript is ready, I would write the abstract, and the last of all would be my title. The title should be precise. It should reflect what the paper is about. It should include the nature of the study, that whether it's a randomized clinical trial, prospective study, retrospective study, or case report in the title. And of course, proofread your article. Check for grammar, check for spelling, consistent language, and check for the flow of article. It is good to have somebody else give a look over your article to help you with these things, because when you have been writing it and revising it, your mind already knows what you're saying. Somebody who's not involved in it and a fresh look can give you a good idea about how to do it. And of course, then finally we come to submission. Identify appropriate journal for the article. The journal suggesters are available from various publishers. Read the author instructions carefully. Format your article appropriately. Let it sleep. Keep it away for 4 to 5 days. Ensure all your co-authors have had a look at the manuscript. Use track changes when each person makes the changes, so it's easy for the person who's taking the lead in writing to actually finalize the manuscript. And as I said, ask somebody who's not involved to give their suggestions. And once all of this is done, you can let your article fly.